Thank you, Dr. Washington, for agreeing to this interview. I guess, firstly, I'd just like for you to introduce yourself and tell us a little bit about you and the organizations that you work with.
Yeah, thanks, Connor. So I'm Dr. Latonya Washington. I'm a board certified internal medicine and pediatrics physician. I currently work at St. Francis Hospital, Memphis. I also hold the position of the president of the Bluff City Medical Society. The Bluff City Medical Society is an organization focused on community engagement, elimination of health disparities, development of standard clinical practice, and mentorship of prospective and current health professional students.
All right, great. Give me one second while I pull up these questions. Okay. In your opinion, what are the most pressing health-related issues facing the communities that you serve?
I think some of the most pressing health issues are number one, access to care. I think number two, healthcare literacy. And then number three is access to healthy environments. And when I say environment, I mean everything that is around the individual, like where they live, work, and play.
Okay, thank you. And then, of course, the name of our group here at UT is the Health Justice Collective. So, what do the terms health justice and health equity mean to you?
Yeah, so I'll start with health equity. I think that health equity means removal of any type of social or economic or geographic elements as related to healthcare or healthcare delivery. And by the same token, when we talk about health justice, that is what are the specific actions that we can enact that will lead to adequate and equal access to quality health care, and also having that access protected under the law.
All right, well, that does a great job as well in sort of addressing the follow-up, which is what are some of the steps for achieving health justice here in Memphis. I'll leave that up in the event that you want to say anything else about that.
I think that there are several things that we should do to improve the quality of health in the communities. I think number one is public health education. One of the things that we've seen throughout this pandemic is that there's a lot of inadequate information out there. And I think it's important as healthcare professionals that we provide appropriate health education access to our patient population. It's also important that our community increases access to quality jobs. Consider things like community gardens in areas that we know are food deserts, and making sure that schools have adequate healthcare programs that are enacted within the school so that we're able to capture those who may not have access to healthcare when they're at home.
Absolutely. On a related note, I know earlier you mentioned sort of taking into account all the environment that people live, work, and play. I feel like as you've been talking about in terms of health justice, it makes me think, what are some of the city resources that are needed to mitigate factors that are contributing to poor health outcomes?
I think that these things are, they're rooted in funding. It's very important that we have funding for the various things, whether that is providing adequate food resources for our patient population, providing adequate food resources at school. It's really tough now during the pandemic where kids haven't all gone back to school, going to classes physically, and so we have to understand that there are a lot of children out there who may not have access to 3 meals per day. I think that it's important that our city resources be pushed towards that. I think it's also important that we have a robust public health education effort to get out the important community information that we want our patients to know, and that they also have a good understanding of how they access quality health care, and understand that that may not be in the emergency department. There may be community clinics that they can go to receive adequate care.
Most definitely. So I think, especially in the last several months or year or so, there's been much more of a national conversation on race and racism in particular. Racism in providers' implicit biases contribute to reduced health and wellness, especially among vulnerable, marginalized patient populations. How do racial and ethnic, gender, sexual orientation, class, or other biases specifically impact your patients and clients?
Right. So there are sometimes when I encounter patients who may not have been adequately treated or diagnosed with certain conditions. And it's important that I, as a physician, recognize that once those patients arrive to see me, that they are forming an opinion and I am also influencing their view of the healthcare system. We know that racism and implicit bias in healthcare may cause certain providers to have preconceived notions about patients, whether they are experiencing pain or not, whether they have a tendency of having certain medical conditions or not. Um, those providers may also perceive the patients as being non-compliant or dismissive of their healthcare issues when those patients may not actually have the ability to follow a treatment plan due to the lack of understanding or the lack of financial resources to even afford that treatment. And so we understand that that is a huge thing in healthcare. Also, we have to recognize that patients may also have their own biases about the healthcare system. They may feel that if they're seeking care, it won't be adequate. They might feel like they are not receiving a standard of care or that they're being experimented upon. And they might not feel that providers would be honest with